Brilliant. I can't see you, so if there's any problems, do shout out or pop it in the chat. Okay, lovely. Right. Let's go. So, good morning. I'm Maria Kildunne from Healthwatch, Chief Officer. Hopefully, most of you know me. I'm also co-chair of People and Communities subgroup of the Shadow Locality Board, which I'll talk a little bit more about as we go through the conversation. I'm joined by Kathryn Rees from Stockport Council, who is the Service Director for Strategy and Commissioning. She's also supporting the development of the ICS strategically and can provide some oversight later on, hopefully, about the locality governance arrangements for Stockport, and hopefully help me fill in any gaps that I miss as we go along. But one thing is, we're both really passionate about this new opportunity to make sure local voice is embedded throughout the new system. Kathryn, do you want to introduce yourself properly? If I've probably said
no, you did a brilliant job. You did a brilliant job there, Maria. So hi everyone. Yeah, my name is Kathryn Rees. As Maria said, I'm from Stockport Council and I'm working really closely with Maria on this. And I'm happy to help you, Maria, as we talk through this, because I think sometimes I struggle to get my head around all the legislative changes, and sometimes it can feel a bit kind of governance and structural heavy. Would you agree, Maria? And I think what Maria's really passionate about, people and communities, and what difference is this going to make. So I think that's the bit that we kind of really want to get to, isn't it?
Absolutely. And it's always difficult to sort of pitch this kind of presentation because there is so much background governance and structure, processes going on. So trying today to let you know about what we know about ICS in as plain as terms as possible, and to start the conversation about ICS, integrated care systems, what it is, why they're needed, how it will develop and operate over time. But really, we want to know what questions you have, so that we can go away and ask those questions on your behalf. Your thoughts and suggestions will shape recommendations that are made to the locality board, and then we can build on further conversations that we have. It's not the first conversation we've had. Sector 3's had an introductory session. I know the People and Communities Working Group are planning more drop-in sessions in localities. There'll be workshops. So it certainly won't be the last conversation we have as Healthwatch, which is why we won't be going into loads and loads of details about the ICS, but providing that brief overview. And so I'm really keen to hear what you know about it, what questions you have, and what you might believe it might be, and your ideas for public voice and involvement, and what you want to see in future sessions. Because I'm not claiming to be, and I don't think Kathryn is claiming to be, an expert on this. We're all learning as we go along, but let's have these conversations and learn together. So just a little bit background about Healthwatch. Most of you know, being Healthwatch members, about the work that we do, but we did open the session a bit more widely. So I'll just very quickly provide a summary of why we exist and why we believe we need to support the voice of local people and communities. So we've got a very specific role laid down in legislation under the Health and Social Care Act, which we have a duty to promote and support the involvement of local people in commission and provision of local care services. We need to enable local people to be able to monitor that standard of provision of local care and whether services can be improved. So we've got another duty to obtain the views of local people about their needs, about their experiences, and how we make those views known to those responsible for planning services. We also make reports and recommendations and formulate views based on the feedback that we receive from people like yourselves about how they can be improved. And in addition to presenting those to providers and commissioners, we also advise the CQC through Healthwatch England to conduct special reviews or investigations about particular issues. And then obviously, most of you know, we provide an advice and information service as well about people accessing care services, so they can make informed choices about the services they access. And obviously, we're part of a bigger picture. Healthwatch Stockport is part of Healthwatch in Greater Manchester, so we're one of 10 as part of that, and we're working together with our colleagues across Manchester to ensure that we've got a good working relationship with the ICS at GM level. So let's back to basics. What are integrated care systems? So they're really about partnerships really that bring together the NHS providers and commissioners, along with local authorities who also are providers and commissioners across a geographical area, to collectively plan health and care services to meet the needs of the local population, with a great emphasis on integrating care across the different organisations and settings. So it means more joined up hospital and community-based services, physical and mental health, looking at the person from you know, a holistic point of view, and generally bringing health and social care together. The intention is that ICSs will bring about major changes in how health and care services are planned, paid for and delivered. They are a key part of the future direction for the NHS as set out in the long-term plan. And many of you have heard or seen the 10-year plan, which sets out the initial plans for establishing integrated care systems, and there's a big consultation about that in 2019. So the ICS was set up across England with key responsibilities placed on primary care networks, and they set out the direction towards place-based population health, so more care closer to people's homes and communities. It also sets out plans to improve priority areas such as children, young people, cancer, heart disease, stroke, respiratory disease and mental health. It's also hoped that it'll be a vehicle for achieving greater integration of health and care, improving that population health, reducing inequalities, moving away from that shift of, you know, we've had an era of provider competition, organisational silos, so we want to move away from that commissioner-provider split, and they will depend instead on collaboration with a focus on place, local people and communities being that driving force for improvement. And this has been developing in Stockport over the years through transformation partnerships, etc. It's been a bit of a start-stop process, as most of us know. We were almost there with Stockport Together. However, you know, currently the leadership in Stockport is strong, and there's a lot of experience on which to build upon. So why are integrated care systems needed? So, you know, the NHS and the population is very different now than 70 plus years ago. I mean, it's very different from 2 or 3 years ago. But, you know, back in, you know, the day, the NHS was set up primarily to provide treatment for acute illness. Now it needs to deliver so much more. So it needs to be delivering joined up support for increasing numbers of older people and people living with long-term conditions. So as a result, the NHS and its partners need to work differently and think more, you know, more outside the box around providing more care in people's homes and breaking down any barriers that exist between services. They also have the potential to drive improvements in population health, as I mentioned, and tackle those health inequalities by reaching beyond, you know, the NHS, working more alongside, you know, the local authorities in partnerships and the voluntary sector to address the social and economic determinants of health. You know as well as I do that it is those wider aspects of people's lives, you know, the people's homes, their financial situation, opportunities for education and employment, access to services and the environments in which people live that have the greatest impact on health and well-being. So we need to really address all of those to actually maximise that impact. And so the case for collaboration is, you know, stronger than ever. You know, the experience of the pandemic has shown that particularly, you know, the response in Stockport of the different parts of the system coming together to enable, you know, the provision of essential services to continue. We've supported people to remain well in their communities, you know, the successful vaccination programme. So, you know, there's this renewed, I think, conviction and determination to work in collaboration with each other, which is a really positive step forward. So this slide, I've stole it from the King's Fund. It tries to sort of set the scene of the framework that's happening nationally and how the system place neighbourhood fits into that national framework. And then I have tried, forgive me for my my presentational skills, but I've tried to simplify it in terms of the framework for Stockport. So here we have the system, which is the integrated care system, which is at GM level. And then we've got the place, which is Stockport, and Stockport being one of GM. And then we've got the neighbourhoods, which are, we've got 8 neighbourhoods in Stockport and 7 primary care networks, which slightly overlap in some areas, but hopefully I've got the neighbourhoods down wrong. Kathryn, correct me if I'm wrong. I did that from memory.
I think they're right.
Oh, I think so. It's hard because sometimes the primary care networks are slightly different
That's right.
in geographical, but you know, we can work around that. Just moving on. So Kathryn, if I want to bring you in here, you'll be able to explain a bit more about the detail about how the Stockport model will operate in reality, I guess.
Yes, thanks so much for that, Maria. And also, I love your diagram that you did on the map. I didn't realise you'd done that. I'm dead impressed. I saw that this morning. Yeah. So I suppose what Maria's describing is there's kind of almost 3 levels to the integrated care system, for want of a better description. And there's what will happen at a GM level. So the GM Integrated Care Board will be an NHS body, an NHS organisation, and that will take responsibility for the functions that are currently done by our 10 CCGs, if that makes sense. So the GM Integrated Care Board will take over the functions from what's currently done by our 10 CCGs. But what that GM Integrated Care Board will do is it'll delegate some functions and some money to us as Stockport. And there's been a big piece of work done to decide what's done at a GM level and what's done at a Stockport level. And the example I always use, because it makes sense to my mind, is at a GM level, they might be making decisions and commissioning things like cancer care, because it makes sense to commission the Christies and fund the Christies at a GM level rather than each 10 local areas do it, because that's done across GM. Whereas other things like district nursing, as an example, which is really local, which is done in all of our communities, it makes sense rather than that to be decided at GM level, for the decision making for that and for the money of that to come to us at Stockport level. So hopefully that kind of makes sense on the kind of levels. And then as Stockport, we'll also, as Maria described, want to think about how we deliver in neighbourhoods. So this kind of diagram in front of you, and again, apologies, because this is a bit governance-y, not necessarily about, well, what difference is it going to make, is, well, what would the arrangements have to look like in Stockport to be able to ensure that we're delivering for Stockport residents, and that GM has the confidence that they can delegate that decision making and that authority down to us. So there'll be a version of this that looks quite similar for all the other 10 local areas. And what we're saying in Stockport is we will have a locality board in the middle, and that locality board will be the key board that is responsible for setting the strategy around the delivery of health and care outcomes in Stockport. And the membership has to include the council, the foundation trust, Pair9 Care, primary care, and the voluntary and community sector. That's what it has to include. And we've currently got a shadow board in place that's overseeing the transition, and Healthwatch are a member of that shadow board, and we've got reps from all those organisations. But the other thing that as Maria was saying, is we know that people's health isn't just about the health services they have. It's about housing, it's about education, it's about employment. So because we recognise that, what the locality board needs to think about is how does it engage wider people like housing, like education, and like police. So that's something else it'll do. Underneath the locality board, there will be a provider partnership, and the provider partnership is basically what I describe as the delivery arm for the locality board. So that is all of the providers. So again, you know, all the people that are delivering health and care services in Stockport coming together and saying, how do we work better together for our residents, for our communities, for our patients? How do we integrate? The locality board has said this is the vision. How do we make that a reality on the ground? So that'll be the role of the provider partnership. And then sitting underneath the provider partnership then is all our neighbourhood delivery. And part of that's through the primary care networks. But I'm sure you know how we work in neighbourhoods, you know, it is really kind of diverse and needs to think about, well, what does neighbourhoods mean to local people, which, you know, isn't what we in public services always mean. The other thing is the locality board then has got a reporting line up to, like I said, to Greater Manchester Integrated Care Board, and it'll also have a relationship with our Health and Wellbeing Board. And our Health and Wellbeing Board is a statutory body. It's been in place for quite some time. I don't know how familiar people are with Health and Wellbeing Boards. But the Health and Wellbeing Boards will have a really important role, again, in checking and challenging that locality board to say, are you really delivering on and making a difference to the people of Stockport? So that's why that's on there as well. So it's a bit, it can feel a bit kind of, to me sometimes, I know it can be a bit governance-y, putting things in boxes, but I think the question we've got to ask ourselves is, there's a few things. One, this is changes that are happening nationally. We have to respond locally in Stockport if we want to keep decisions and the money flowing to support Stockport residents. So I think there's important that. And we also are part of that GM model, so we need to also play our part as one of the 10 PGM. But I know there'll be time for questions and answers. So if any of that didn't make sense or we need to go through it in more detail, then we can. Is that all right, Maria?
Yeah, absolutely perfect. Thank you, Kathryn. Yeah, don't worry if you're not getting it straight away, because it took me a few times of reading different diagrams, and you know, you'll find a diagram that you like. You know, even within the office, we've all got a diagram that we like, that we go to, that explains it for us. I suppose in terms of just as part of the sort of subgroups that sit under the exec group, one of them is the people and communities working group, if you like. And I thought, I came up yesterday, I started thinking about it, and it's more of a people and communities partnership, I guess, isn't it, Kathryn? Because
yeah, it is.
It's about, you know, people like yourselves, people, you know, affiliated to groups, organisations all across the voluntary sector, engagement workers within the council and you know, health services, coming together to actually think about how we can embed that public voice across the system. So I co-chair that with Vicky Murphy, who's the assistant or deputy director of adult social care. You know, and it's a fairly new group. We're still getting to know each other, still finding our feet. But I think, you know, it's got a really important job in actually being that golden thread that we talk about going through the system. So yeah, thank you so much for that, Kathryn. I skipped a couple of slides ago, so I was a bit jumpy before when I went onto the slide. I think I missed out this one. But just to sort of give that bigger picture across England, because there is 42 ICSs across England, and Greater Manchester is one of them. But just to, you know, Kathryn, you know, sort of described as well, there's no real blueprint for developing the ICS. There's lots of guidance around the ICS, but this, you know, is quite permissive in the legislation. So the approach leaves, it seems like it might leave some uncertainty, but, you know, as Kathryn described, with, you know, Stockport's on it, but it gives that advantage that enables systems to arrange arrangements that are best suited to the local context in which, you know, we're all working and living in, which builds on the strengths of the existing relationships that we've had throughout, you know, over the years. And there's, you know, it'll be based on a willingness and that commitment of organisations to work more collaboratively. So sorry, I jumped that slide earlier. So then, you know, just what might integrated care systems mean for you as you know, patients, residents, communities? You know, this framework allows and puts people really at the heart of you know, integrated care systems, and they understand that people and communities using health and social care, you are the best people placed to understand what you need, what's working and what can be improved. So, as I said, there's lots of guidance that's been produced, and NHS England has provided some specific guidance around working with people and communities, and it sets out 10 principles in which systems can work with people and communities, creating that golden thread I was talking about through the system, right from, you know, neighbourhoods right through to ICS level. You know, and there's nothing in here that, you know, none of us would disagree with. It's making sure we put voices and people at the heart of decision making. We start the engagement early, we start those conversations when developing plans so that people really do feel involved. We understand communities' needs, so, you know, we understand their experience, their aspirations. We use these engagement mechanisms to find out if change is having the desired effect. We need to build relationships with excluded groups, so, you know, addressing those health inequalities, working with ourselves and the voluntary sector as key partners, which, you know, I think in Stockport there's a real commitment to do that, which is great. There's we need to provide clear and accessible information, and I know this is something that comes up in our people and communities group around key messages. You know, what are those key messages that we need to get out to the people and communities to build that trust? You know, what community development approaches are out there that we are using that we can build upon and make those connections for social action. Using co-production methods and insight into the engagement and the feedback that we receive, and then using that feedback to co-produce, redesign services and tackle system priorities in partnership with people and communities. And then learning as we go, always about learning and building on the relationships and networks that's in place. So how will, you know, we incorporate all this into the integrated care systems? You know, how can we integrate listening? So the current picture looks a bit like this. You know, we've got national surveys and polls, we've got the GP surveys, we've got local groups and forums such as, you know, patient participation groups. We've got public and patients in governance. So we've got, you know, lay representatives on CCG governing bodies. Healthwatch are on a you know, we think we've got about 30 seats on different committees and boards across Stockport. We've got consultation, which, you know, the local authority is good at providing consultations and engagement. We've got the complaint service at the PALs at the trusts, and there's, you know, all kinds of proactive engagement that's often and routinely carried out. So that's all well and good, and that's how we've been doing it up until now, and we've kind of been doing it a little bit in silos. How can we build and pool all that engagement work together? You know, these are some of the questions we could be asking to determine how we can form a new integrated listening system. You know, so how do the existing structures that we've just talked about and the roles translate between the neighbourhood, the place and provider, and where are the gaps? How will people's voices be considered in decision making at all levels? It's, you know, and will leaders create that culture of listening? What needs to change to enable that to happen? Do people feel that that is happening, or is that a vision? And how do we meet that vision? How will what the system hears be brought together and move away from that fragmented listening to be a cohesive, integrated listening for integrated care? How will the system build proactive channels for conversation and ongoing relationships? And how do we really listen to people who experience real health inequalities? What are the existing resources out there for engagement within the system? Obviously, engagement doesn't come for free. You know, how can we pool those and maximise the resources to gain and maximise that influence? And what does good look like? You know, does good governance and accountability for listening? So, you know, what does that look like? You know, do we know what that looks like? And I know Andrea Green, the accountable officer at CCG, is coming to Healthwatch next month to talk about accountability and how does that look like, because on the face of it, we've got all these boards that Kathryn described, but again, a lot of the people are the same people on those boards, and how do we hold each other to account, you know, and not marking our own homework, so to speak. So finally, I think, you know, what do people and communities need to know? You know, you want to know who's making the decisions that affect your care. How are you being listened to? How do you tell if something needs to change or isn't working so well? And who do you tell? And how do you know if action needs to be taken? So I guess it's over to you really about, you know, what questions and suggestions you have and how you might get involved. You know, there's some suggestions there around, you know, your Healthwatch members, so we'll always keep you updated and join you in the conversations through Healthwatch. There may be a wider forum that might be established as part of this people and communities group work or partnership. You know, we've got feedback mechanisms here at Healthwatch. How can they be strengthened to include feedback across the sector? And that's something Healthwatch hopes to do over the course of the next 12 months. You know, what are your expectations? What do you want to see more or less of? What key messages could the system produce that would build that trust with the public and local community groups? So I'm going to leave it there.